Our fourth question is, what role does risk communication play in allocating scarce healthcare resources? Risk communication is a process to effectively deliver current information during situations that generate a fear of health or environmental risks. The audiences are healthcare professionals, staff, and the public. Trust encourages cooperation. In the midst of crises, people will be more willing to endure disruptions and to tolerate rationing of healthcare resources if they are kept informed about the situation. Using risk communication techniques is the best way to provide this information. Most people are afraid of the unknown. In a crisis, this fear becomes exaggerated. Most feared are events with delayed, irreversible, or man-made effects, those that have new, unknown, or unobservable risks, and global catastrophes. People also exaggerate the risks of events hyped by the media. Conversely, people tend to play down risks with which they are familiar. Risk communication helps healthcare workers and the public identify actual risks to themselves and their loved ones. It informs them what is being done and what they can do to minimize or avoid risk. Specific risk communication methods help break through people's fears so that they hear, understand, and remember the information being communicated. Specific ways to do this include delivering in their order of importance no more than 3 brief, clear, simple messages, repeating messages and using clear visual aids or demonstrations to help clarify the information. Because negative messages are always heard better and remembered longer than positive messages, limit their use. If a negative word, such as no, not, never, nothing, or none is used, at least 3 positive statements should balance it. Successful risk communication also requires using the same appropriate, trusted spokesperson to deliver the messages. Choose an appropriate person for this. In fear-producing crises, people will not listen to the message unless they think that you care about them. So the spokesperson must be seen as caring and empathetic, which listeners determine in the first 9 to 30 seconds after they begin speaking. Spokespeople also must be seen as experts who are competent, honest, and dedicated. Risk communication should be implemented using multiple communication methods, including press releases, press conferences, public meetings, if safe, interviews in the newspapers and live on radio, TV, and internet, phone banks, email responders, websites, flyers, and fact sheets. Within institutions and organizations, risk communication should also be implemented through public announcement systems, closed intranet systems, in-house TV systems, and employee hotlines. The benefits of using risk communication in crises include that it increases cooperation if resource allocation is necessary, increases the likelihood that healthcare and support staff will remain on the job, and provides current safety and health information to the staff and the public. In conclusion, we must have not only rationing plans to distribute scarce healthcare resources, but also pre-designated cadres of trained and experienced crisis triage officers ready to make difficult resource allocation decisions with authority commensurate with their responsibilities. We must also employ risk communication techniques through multiple communication systems to provide information and to maintain the trust necessary to implement allocation plans during crises. This series of videos has shown that 1. Nearly every discussion of disaster plans calls for an ethical basis for resource allocation decisions, but few specific suggestions have been offered. 2. It is far better to make hard decisions about resource allocation before rather than during disasters. 3. Disaster or triage plans based on sound ethical principles must include equitable, not equal, distribution of resources, prioritize patients based on fairness and utility, have a moral agent, the crisis triage officer, to implement resource allocation. Both the medical and potential patient communities, stakeholders, must be aware of this plan and buy into it through community focus groups, and using appropriate risk communication techniques, establish trust and facilitates resource allocation and disaster management.